Hey guys, what's going on? I'm Dr. J.
I am Dr. I, and we are the Twin Doctors, and this is Second Opinion with the Twin Doctors. All right, Doctor, my favorite thing to say. Doctor, give me the news.
What is in the news? Well, it's really a question. Is calorie-restricted dieting, while good for your waistline, bad for your mental health? Research says that it might be. So there was a study that came out recently that found that people who severely restrict their calories tend to exhibit more signs and symptoms of depression. And it makes sense when you think about it. And what was also interesting, I should say, about the study was it seems to affect men more, which makes sense. We're the weaker sex, we're big backs, we like our food.
I know I'm depressed when I diet.
I know.
I believe it.
Tell me about it. So what the science found was this. When you restrict your calories, you don't just restrict your calories. You restrict your intake of complex carbohydrates, you restrict your intake of micronutrients, things like zinc, vitamin C, vitamin B, omega fatty acids. And these are all things that are very important in the production of serotonin and dopamine. Those are those feel-good chemicals. Less serotonin, less dopamine, maybe a thinner waist, but your mental health may suffer. So that is what's in the news.
All right. So we have two amazing guests joining us today. We've got Dr. Bel Natarajan, a licensed doctor of acupuncture and traditional Chinese medicine, and Dr. Muhammad Shalabi, a licensed doctor of chiropractic medicine. They're both going to be joining us, and we're excited to have them.
And what are they joining us for?
What do you mean, what are they joining us for? They're joining us for the episode.
What's our topic? Our topic
Oh,
is...
yes. Did I forget to say the topic? I forgot to say the topic.
Mm-hmm.
Okay, needles and adjustments, acupuncture and chiropractic medicine explored. See, I must be dieting, right?
You are dieting. You're not the good.
How to have them.
All right, Dr. Shalabi, thanks for joining us. We are really happy to have you on. This guy is like the TikTok star here. You got like, what, 2 million followers?
Yes, I do.
That's amazing. That's amazing. So, I have to say, I was doing some research on chiropractic medicine. I didn't know as much as I probably should have. And I was going through the history of chiropractic medicine. And so apparently there was this guy, Dr. David Palmer, who started the art form. And he had this theory of what they called subluxation, where, from what I understand, but again, I'm just an OBGYN. I don't know much, so I'm leaving it up to you. But it's kind of this concept where there is misalignment between joints that somehow affects nerves, and then that leads to disease?
Yes. In the early days, that's what it was. Like, there is a subluxation. It's a misalignment, pinching in the nerve that will cause disease. So it started as what we call as straight chiropractors, and that's all they believed in. And there was a lot of schooling for it. Then you have what we call the mixers, which is what we have more today. And they say when there is a subluxation and it's affecting the nerve, it will be affecting more the function and pain. And that's where the concept is changing more towards that second.
No, gotcha. And so do you feel like over time chiropractors have had a hard time being accepted? Do you feel like people are more accepting of chiropractic medicine now?
Yes. Before there was not a lot of schooling or a lot of education behind it, but now there is more schooling, more education. And then there was medical groups that were trying to shut down chiropractic.
The AMA, right? The American Medical Association was trying to shut down chiropractic medicine altogether. Yes.
And then there was a lot of based studies and research that has came, and we gain more paced prospect and educational about it. And in the 1970s, there was a lot of studies that was done, researches, and that's where we start getting more respect.
Right.
So let me ask you a question. Sure. So you said that there wasn't really formal schooling. Were they just lay chiropractors? How did they get their training? How did they hang up their shingle?
Before, there was a natural healing. Dr. Palmer in 1985, that's when chiropractic started. And then after that, there was now more schooling and more training to become a chiropractor.
Okay.
All right. So, and I know that actually there was a chiropractor, I think in the 60s or 70s, Dr. Wilk, who sued the AMA because the AMA, basically being as powerful as they were, they said, we don't recognize chiropractic medicine. That basically meant that doctors couldn't refer to chiropractors, insurance wouldn't pay for chiropractors. Antitrust lawsuit, Dr. Wilk wins, chiropractors are accepted. So what kind of conditions do chiropractors treat, or what kind of conditions can they treat?
Back pain, neck pain, headaches, sciatica, that's what we'll treat.
Okay, all right. And what are your diagnostic tools? So it's come in, I'm having back pain. What do you do?
Like what we did exactly.
I was gonna say, yeah. I went to his office. I was impressed. You had a lot of really cool toys. So what kind of diagnostic tools and technologies do you guys use?
We do x-rays, we do posture scan, we might send out for some MRI if we need to. All that stuff we do for sure, very deep history and examination before doing anything on a patient.
Cool. Okay. So we're going to show people the initiation of my visit. So I had never been to a chiropractor. I was super excited to do it. And so we're going to share with the viewers a video of what the initial evaluation looked like. But after the initial evaluation, what does typical treatment look like?
Typical treatment look like, I do some, as what we put in that roller bed, to kind of relax your muscles a little bit. And then we move on to the adjustment, and we do like a full body adjustment. That adjustment is specifically to the patient condition from what we found in the history and the examination, whatever other imaging we did before.
So when I went there, you put me on the roller bed.
Yes.
And this little bed where there's these rollers that really just, it felt like did almost like a deep tissue massage.
Yes, in the paraspinal muscles, yes.
Okay, so do you get better manipulations if you relax the muscles first?
Yes, it's like not working on the muscles when they're really hard. You're gonna loosen them up first so I can be able to do that just.
Okay, all right. Well, let's show people what my initial assessment looked like. Well, I've never actually seen a chiropractor before, so I'm excited. I figure a little snap, crackle, pop, I'm gonna be all fixed, flexible, and ready to learn.
There we are, very good. So this is the first picture. We're gonna go to A to P so I can take a look at everything from the front to the back. However, we look at it from the back to the front. Okay. Most doctors, we look at it backwards because we work on you from the back.
Right. Okay, cool. Well, mid-X-ray, apparently there may be a problem. Dr. Shalabi says he thinks he sees something. He's not sure, but he thinks he sees something. But he wants to get a few more views first. Now, I'm curious, and I don't want to know what he thinks he sees, but he's not quite ready to tell me yet. First, more views, and this means turning laterally to my side so that we can get extra views of the spine. At this point, I'm intrigued, I'm nervous. But, hey, let's see what he finds. Well, turns out he found I'm crooked. I've got a crooked spine. I'm like Forrest Gump. I'm all twisted up. I've got scoliosis. But, there is more. Apparently, I've also got bone spurs, 2 lovely bone spurs, 1, 2, and I've got a degenerating disc to boot. In short, folks, Dr. J is a mess here. Dr. Shalabi, Dr. J needs you to fix him, please. So when I walked into your office, you told me that even before you examined me, you did x-rays, you put me on the roller bed, you were already kind of sizing me up. You were looking at me to kind of get an idea of what might be wrong with me. I'm sure you found the
How many things were wrong with you?
I know.
1, 2, 3.
But what kinds of things are you looking at just when the patient walks in and you're sizing them up?
Exactly. Like when they walk in without the patient even knowing that I'm looking at them, I look at how they walk, how they sit, how they bend, if the pelvis is uneven a little bit, if the shoulder is even, if they have that forward hip posture, do they like to sit like this on one side, that way? So I'm building up my evaluation before I even get my hands on the patients. And guess what? Like what I did, I told you before even taking the x-rays, this is what's wrong, that's what I'm looking at, right? Yeah, so it makes it a lot easier and it builds a lot of credibility for the patients to know what I'm doing, what I'm talking about.
Yeah.
So I'm just confirming what I saw. When you do something and someone is looking at you, what are you gonna do? You're gonna try to change it right away.
Of course.
So I'm gonna catch that before they even do it. So like I did it with the
You
other.
basically realized that I was flawed and messed up before I could even hide it. So that's an amazing skill. I got to give the credit.
I've got to imagine when you go out, when you're just out at a restaurant, or are you looking at people like, okay, look at how they're walking, how they're sitting. You're probably like sizing everybody up.
Yes, I do. That's a problem with being, like a Muslim. And when I go pray and I'm praying, I always have to be like this. I'm looking down. You can never catch me having my eyes open because this guy is that way. This guy, I can't concentrate. We're supposed to focus and you see me going like this. Astaghfirullah, like, I can't look anywhere. That's the truth.
I believe it.
When I walked up to some people in the street, I'm like, yeah, back pain, what's going on, neck pain, you're having sciatica. It's something you do every day. It's like,
And when you walk up to people, just kind of the cold call, basically. How do people react? Like, get away from me.
Some people is like, as you know, I have like 2 million followers on TikTok. Some people know me from social media who don't know me and say, I'm Dr. Shalabi, I'm a chiropractor. I see this is going on. And actually, I try to connect them with the local chiropractor that he can go see and get help. I'm like, you shouldn't wait because if you wait, that will get a lot worse. It's better to work on it right away.
You should carry your table in your trunk. Yeah. You see people walking funny, sitting funny, curved over. You can do a manipulation right there. That's a TikTok idea.
There you go. Maybe that's the next step.
So what do we learn, Dr. J? What do we learn about you?
Well, so we basically learned, I guess they saw in the video, but I've got scoliosis. I've got some bone spurs. I've got a pinched nerve. I said, Dr. Shalaby, am I going to live?
So this confirms what I've always known. I've always known this guy was crooked. Like, I was like, he's crooked. Like, there's something wrong with him.
It's just my spine that's crooked. He thinks it's my character that's crooked.
No,
I don't know about all of that. I don't know about all of
Great
that.
character. I love it. I love it. We had a lot of fun. Actually, we were just having fun afterwards.
Can I tell you, if he had come with us, we would have had no fun.
No fun whatsoever. Exactly.
So, please go ahead. Oh, I was just going to ask. So, chiropractors, they're accepted now, you know? Do chiropractors oftentimes collaborate with other providers? Physical therapists, for example.
We do, definitely. First of all, with physical therapists, I do refer to a lot of physical therapists.
So there's no competition between physical therapists and
Definitely not, because we work more with the immediate pain relief, chronic pain, moving the bone, adjustment. I refer to physical therapists for exercise, rehabilitation, and strengthening. So I do refer a lot of physical therapists. Also, a lot of medical doctors refers to us, and we refer to them. Pain management, orthopedic doctors, we all work as a team. And another thing, you know what, with like when I just posted something recently, I do get a lot of patients, and I'm telling you that maybe not a lot of doctors talk about it, mental health.
Oh, okay.
Right. So that's a very subject not a lot of people talk about.
Yeah.
So you get these patients who are having neck pain, headache, numbness and tingling down their hands and their arms. And when you take the x-rays and you do the exam, you keep adjusting them. These patients are not getting better. Why? Because we hold a lot of stress in our trapezius and resentment. And so what I do is I refer them off to see a therapist, psychologist, and we work as a team, and we see great results with these patients. The symptoms will start going away because they're letting everything out.
I was wondering, I was going to ask you, like, how tailored is the care? So you've got somebody like Jamil who's messed up with his pinched nerve and scoliosis and bone spurs and all of that. Then you have somebody like me who comes in very healthy, great posture. You know, do we have the same treatment plan, or is it very tailored to the person?
Perfect. It's very tailored. So someone like you will come in for like a wellness care or a maintenance care. All right. Let's say he's having an issue or a problem. We're going to be specifically to his condition. He's going to get the adjustment according to what we found in the exam and the x-rays to him, specifically to his condition.
Okay.
The same thing, like if we see a pregnant woman, or if we see patients with arthritis, or we see patients with a lot of spur, it's very tailored to every patient.
He's going to say something mean. What are you going to
Look at him. Is he healthy? Do your little quick
Size me up.
No, now he knows I'm looking.
Yeah, no.
Actually, I did as you're walking in. But I didn't want to say nothing.
Tell him later off camera. Right? Yeah, there you go. So, okay. It seems like chiropractic medicine is just moving in leaps and bounds.
Yes.
What kind of innovations are in the pipeline? Like, what kind of emergent trends are we seeing?
Good. You've seen we do exercise, nutrition. Have you seen some of my videos where I do that balloon treatment?
Yes. I've seen that. Can you tell people about that? Actually,
Yes.
That's crazy.
That's been out since the 1920s. It's called the cranial facial release. So it's inserted in a balloon inside. Then you've seen that?
I don't
We
think
should try that.
I don't think I can do it. I don't think I can do it.
No, we'll do that the next time. We'll do that next time on him.
I've got a horrible gag reflex.
No, because it's going to go inside the nose. So once you insert that balloon inside and you pump it, it will help adjust the cranial bones on the inside.
Wow.
Yes, and it helps. And I also do some cranial work, like another technique called an SOT technique.
What is it?
SOT.
SOT.
Yeah. Okay, that's it. That's another technique combined with the cranial facial release, which is the balloon. And doing that, it will help with the deviated septum, snoring, sinuses, allergies.
Deviated septum.
He does have a deviated septum. I have a deviated septum. I really do.
So that does really help. And I've seen most of the time it's the girlfriend or the wife is bringing the husband because they can't sleep. And then, you know what, they bring me videos, the second visit with them not snoring as much. That's something really, I started doing that.
I don't think I snore, but I know I've got a deviated septum. And the craziest thing is, I didn't even realize I had the deviated septum until I saw a picture of myself. And you know, when you smile, you've got the deviated septum.
Yes.
So I was like, why is my face crooked? Yeah. Somebody put a crazy filter on this. Your septum is crooked. And then I realized that's my crooked septum. So, okay, what about preventative health care? Is there a role for chiropractic manipulation in preventing diseases?
Yes, definitely. We always say the wellness care, it's much better, and the maintenance care is much better until you have a problem. Like nutrition, health, mental health, getting adjusted, stretches, exercise. it costs a lot less to try to work on something because before it becomes a problem. And that's where the main issue of the maintenance care or wellness care. It's much better. You take care of an issue before it becomes an issue. You know, you're not going to miss days of work. You got to stay healthy. And another thing is, let's say when you're sick or when you have a problem, sometimes you're selfish because it's not just affecting you. It's affecting the people around you. So why not work on yourself? Try to make sure you're staying healthy to take care of the other people and not bother them.
No, that makes sense.
And I like, when you mentioned earlier that you work with psychologists and psychiatrists when you're doing manipulations on patients, because oftentimes I think we carry, kind of like you said, our emotions, our anger, our fear in our body. And you can probably manipulate them until the cows come home, but if you don't address this, it's not going to get better.
That's 100%.
I noticed one thing, like I had a very stressful situation about 4 or 5 years ago, right? And I noticed every time I was in that situation, I started getting like intense like headaches and neck pain and back pain. And so I thought maybe it's just stressing me out. My blood pressure's going through the roof and my blood pressure is relatively normal. And every time I was in that situation, I would just get a debilitating headache and neck pain. And I was like, oh my God, like I think I'm literally carrying my stress in my shoulders, head, and neck. Like,
yes, we do. And that's why you have to look from outside the box, not just be focused on one thing and think, adjustment is going to do it all or physical therapy is going to do it all. No, you have to look outside. You step back and evaluate the whole history of the patient. What else is going outside? What else you can do to help them get better?
So changing gears a little bit. So let me ask you, obviously we're OBGYN, so we see a lot of pregnant patients all day, all night, and they have a lot of physical complaints. Is chiropractic medicine safe for pregnant patients? And if so, what is the utility? What is it used for in pregnant patients?
It is, absolutely, it is safe. Actually, a lot of OB-GYN refer patients to me. So you guys should start.
He's like,
we'll start with patients for sure. Message received.
Okay. Even when I was in school, and my son is right there, my wife was pregnant 1 year before, and I did get my certificate as just a pregnant woman and my wife. Pregnancy is very safe. You see it for back pain, pelvis misalignment, sciatica. And when the pelvis is misaligned, they get a lot of back pain. So what I do is we realign the pelvis. It's very, very safe. It's very tolerated to them. And it even helps, the baby to be positioned more better.
So I was going to ask, so I was reading about this concept of pelvic balance, and I was going to ask, what is that? But is that what you're referring to when the pelvis isn't aligned, basically?
Yeah. When the pelvis is not aligned and the SI joint are out of place, so you kind of manipulate it back in place and definitely to get a lot of relief.
Okay, all right. So good for pain relief, but it sounds like it's functional as well because you're saying it can help the baby to get into the proper position.
Yes, it does.
Okay.
There is actually a specific technique for that. It's called Webster technique.
Webster?
Oh, yes.
Yeah, I have to look at it. We should do it in the office.
Yes.
Like, no. I will. So sorry, go ahead.
Go ahead.
No, please, go ahead.
No, I was going to say maybe, I don't do Webster, but if you find a close chiropractor who does Webster technique, that will be something really, really good.
And what about their labor? So fine, they have these manipulations. They feel better. Baby's more likely to be in the right position. Does it help with the speed of labor, the comfort of labor?
Yes, it does. And I have stories, patients who I've seen during their pregnancy and after. And because once the pelvis is aligned, they will have a better labor. Just a couple months ago, I adjusted this lady who probably third or fourth baby.
Yeah.
On their way to the hospital, the baby's head start coming off. Oh, okay.
Yes. You adjusted her too well.
So what the husband did is he sent me a very nice gift 2-3 days after. A lot of steak. It was very nice. And I was called, it's in my videos too, I was called to someone's house. She was 3 days past due. I have that video. I'll share it with you. I went to her house. I adjusted her. I remember it was on Wednesday. She had the baby on Friday. And for my wife, from my 5 kids, I will adjust her the day of the delivery before we go to the hospital.
Wow. Yeah. Interesting. So are there any other women's health issues that chiropractic manipulations can be beneficial for? Maybe things like fertility issues, or another big thing is menopausal symptoms, and people are becoming less and less desirous of using hormones and things like that, and so they want to do things that are a little bit more natural. Is there any role for chiropractic manipulation in other women's health issues?
Yes. As far as studies, there hasn't been a lot of studies yet, but have we seen results? All the time. I've helped over my 24 years of practice a lot of female that they were able to get pregnant from the adjustment. If you look at the countries back home, when these women can't get pregnant, they will go to these. No, they don't have chiropractors. To the traditional, and they will actually start pushing on their back to help them get pregnant. So have we seen it? Yes. And menopause, It will also helps with that, helps with function, mobility, and help also with them conception.
And one quick question about pregnancy, because I know people are probably wondering, how early in the pregnancy should patients see a chiropractor?
As early as the first day.
Okay.
Because I see them from before, I see them during, and I see them up until the day of delivery and right after too. Because right after delivery, you do need to get adjusted because your pelvis is off too. You want to make sure it's realigned.
So are there any people, regardless of gender, age, are there any people that chiropractic manipulations might not be safe in? People who maybe should avoid it?
Yes. Fracture, cancer, tumor, severe osteoporosis.
Really brittle bones, basically. Yes. Okay.
You'll get a crack you don't want if you do that.
Definitely no.
Okay.
And what about typical side effects? What are some typical things people may experience after a chiropractic session that's not problematic, it just happens?
We'll say soreness, that happens, it's normal. And something is very rare, which is stroke. And that's why you have to make sure we do a pre-screening, our history, our examination, and it's very, very rare.
And when it's stroke, it's typically that vertebral artery that gets damaged, right?
Yeah.
Okay.
That's why you have to do your pre-screening history examination, make sure nothing else is going on. There is no pre-existing condition.
Right.
I'm seeing him looking at you, Drew. He's been looking at you this whole session. Like I think he wants to adjust you. Like you're just not looking right. You're not looking right. You're not looking right.
Dr. Shalabi, it's time for you to fix me. I'm tired of being crooked. It's been a lifetime of being crooked.
I'm tired of being crooked.
All right, Dr. Shalabi's about to fix me, guys. You're going to witness it. It's going to be either my miracle cure or what's just going to be my miracle cure? It's going to be my miracle cure in this story.
That's the first adjustment ever too.
First adjustment ever,
Wow.
yeah.
I love that.
No pressure, no stress.
No,
I'm going to run out of here.
I love the reaction. See the reaction in their face? Yes.
Yeah, I'm going to be doing somersaults, sitting in the lotus position. I'm going to be a new person. So, all right, let's do it. All right, Dr. Shalabi, you going to fix me up?
Yes. Are you ready?
I'm ready.
Let's do it.
All right.
There you go. So I'm going to get right in here.
Oh, I heard that.
I bet you felt that.
I did.
How did that feel?
That felt good.
First adjustment ever.
First adjustment ever. Wow. All right. Am I straight now?
No, you're still crooked, but he's working on you. He's working on you.
You're working on it. Let's do the other side right there.
Oh, I heard that one. Yeah, I felt it.
Awesome. Go ahead and lay down on your stomach. Face left. Now we're gonna do and hands right in here. So I'm just gonna realign a little bit of that pelvis.
Sizing you up again. He's sizing you up.
Nice. Some lower extremity adjustment. Pelvis right in here. Nice. Now we're gonna be doing that mid back. Okay. So I take a nice deep breath in and let it all out.
Oh, I heard that crack too.
Am I crazy? I feel like I can see a difference though.
Like before you did that, like I could see more of it was more concave.
Hunch.
convex.
Yeah, exactly.
More hunch. Yeah.
You know, that's what we did over there when he came. When we put him in the roller bit to kind of work at this.
Yeah.
You know what we do? That's a good thing you brought that point. Just a real quick education to the audience is as what we do right now. We're in the phone. We're texting. We're pending down all day long. We end up getting that hunchback. So it's really recommended to get like a foam roller. Everybody should be doing that. And just lay down on the floor at home and roll your back on it to try to get that straight up position.
Okay.
Awesome, Doc. I'm gonna have you lay down on your right side, face up. Let me move this. Now we're doing the lower back. All right, bend this leg. Maybe can I bring that up for you a little bit? Here you go.
There's a strange man.
How are you doing?
I'm good. I'm good.
Right there.
Oh. What did that feel like?
Felt good. Felt good. Yeah.
You're next.
Okay, all right.
Let's do the other side.
All right.
Nice. Beautiful. Here we go. So now you get to see both sides.
This side is remarkably less impressive.
Lay down on your back.
I mean, lay down on my back. All right.
Yes. So I'm getting him ready to do a little bit of a stretch this way. That way. Now what's next?
Oh, is it? Okay,
There you go.
it's
Slide
time.
down
That's
a
what I've
little
been
bit.
waiting for. I've been waiting for the strap. Come on.
You're good enough right there. And put your hands right here.
Don't let him strangle Lucrece.
Turn off the cameras.
There you go. And this is the Y strap. Lift your head up. Put it down.
I like where this is going.
So I'm just going to have you take a deep breath in and all the way out.
I heard that. Wow. All right. It's weird. I feel like my nasal passage is just opened.
Yes.
Yeah.
It's not weird. Actually, it is. You're just a patient DC. We can breathe better. We can even see better. We can hear better because it's opening up your everything, releasing that pressure in the nervous system.
We have Dr. Val Natarajan. He is a doctor of acupuncture and Chinese medicine. We're so happy to have you with us. Thanks for joining
Glad
us.
to be here.
So, first of all, can you tell us a little bit about yourself? What was it that made you want to go into acupuncture and traditional Chinese medicine?
Well, my undergraduate degree is actually in computer engineering. Okay. Right out of school, I got a job, moved to Chicago, got a job. I worked in industry for 18 years.
Okay.
But as part of that, I was an engineer. I did customer field support, and I was working, traveling. It was all international travel, Europe, Middle East, Asia, Africa, 100-hour weeks. And I lived as an expat in the UK for a number of years as well. By the time I came back, I had all sorts of strange health issues, which it was unusual for me because I was relatively healthy all my life. And being the engineer, I decided to work it back, and I decided, well, if I was healthy at one point, I should be able to just reverse it. I know it's lifestyle that brought me here.
Makes sense.
So I started researching on my own and did a number of things which helped. But then it wasn't until a number of years later, the first family member to get acupuncture was my dog, Austin, who I adopted.
Your dog, okay.
He was a German Shepherd I adopted.
Tell me more.
And he came with allergies. He was about a year and a half old. And I tried everything. I tried the regular allergy shots, all the steroids, and no matter what, it never really solved the problem. And dietary therapy, everything. Finally, a neighbor said, I know a veterinarian who does acupuncture. So I took him there after the first treatment. He just crashed, subsided, slept most of the time, all his itching, so it subsided. So that was my first introduction to it. As an engineer, I still knew nothing about it. I just knew that this is working for my dog.
Right.
And so we had done that for a number of years. And then my wife and I were trying to get pregnant with our first. And we tried for a year. We did fertility treatments for a year. And then finally we were ready to do IVF. And my wife's OB, she said, I know an acupuncturist. You should try that first. After 3 months, the acupuncturist said, I'm done. And the next cycle, we were pregnant with my oldest, who's now 22 years old.
All right.
He's a junior in college.
It's a bit of an aside, but I just have to ask. Like when I'm trying to give my dog's medicine, right? It's a fight. How did the dog respond to acupuncture? How do you get a dog to get acupuncture?
It's really interesting. At first, they reacted to the needles, but once they realize, what happens after that is they just crash. They'll get this drowsy look on their face, and then they will just lie down and he will sleep with the needles. And then he knows.
Yeah, I believe that too, because when I got acupuncture, I fell asleep.
Oh yeah.
I literally fell asleep, and you're thinking that it's going to be painful and a little bit scary, and I fell asleep. Literally fell asleep. She came back in to take out the needles, and I'm like, what happened? That was yeah, exactly. It's amazing. It's actually very relaxing. So, okay, acupuncture. You do that. What other things do you do as a traditional Chinese medicine practitioner?
So acupuncture is just one tool that we use. It's part of one of the branches of traditional Chinese medicine. So there's acupuncture, there's herbal medicine, there's dietary therapy, there's breath work, qigong, and meditation. And so with the acupuncture, within there's a couple of other manual therapies. There's cupping, there's gua sha. If you talk to a physical therapist, they may know it as Graston technique or Aston. But it's the same. It's a technique where you actually apply a force to the skin and also scraping motion, and that starts to break up any adhesions in the fascia, the connective tissue underneath, and it starts to loosen up the muscles. So those are all the different tools that I use and bring in when I'm treating a patient.
So how does acupuncture work? Like I've had it myself. It works very well for me. I refer patients all the time, but when they ask me how it works, I have a general idea. I'm like needles, there's some symptoms in the body, energy, so on and so forth. But how does it work? Like break it down for patients like XYZ. How does it work?
in simplest terms, what we're doing is we're regulating the nervous system and we're telling the body, giving it direction to heal a specific area, to bring blood flow, increase perfusion to tissue. We're telling it to increase what we call endogenous opioids, or painkillers that are produced by our own body internally. And as we start to reduce the inflammation in an area, the body can start to heal itself. So the main principle is the body already knows how to heal itself, and it's really trying. We're just giving it that nudge with the needles to be able to allow it to bring that problem to resolution.
And those endogenous opioids, that's why you sleep and that's why you feel so relaxed, like you really do.
Yeah. No, and for people who don't know what endogenous opioids are, they're basically endogenous, meaning we make it in our body, and it's basically this. It's similar structurally to like morphine in pain medications. So yeah, you're right. It's very relaxing. So let me ask you this: what is Qi? You hear everybody talk about Qi, spelled with I, oddly enough. Yes. I always thought it was CHI for the longest time, but you hear about Qi. What is Qi, and like, how does it play a role in our health? Okay.
So with the Chinese language, it's very context dependent. So Qi can mean many things. Qi can mean, vapor, it can mean gas, it can mean, for example, I talk about a great way to rephrase it is Qi in the body is function. Replace the word Qi with function. So my stomach Qi, if normally it should move in a downward direction. If the stomach Qi is stagnant, what do you have? You have maybe some bloating and belching. If it reverses, you may have nausea, you may have vomiting or reflux in this case. So I like to use that term. It does also have other meanings. So there's different types of Qi. There is what we call Yuan Qi, which is a Qi that we're born with, that we get from our parents. So that we can look at as genetics.
Oh.
Exactly. And then there's Zong Qi, which is the Qi of combining air and the food we consume. And so you can almost look at that as like ATP, where you take glucose and you take oxygen and you create energy for the cells. And another type of Qi would be our Wei Qi, our defensive Qi in the body, which is our immune system. So the term Qi, we can use it as energy, but it almost gives it a kind of a new age feel, when it really is much more practical than that.
So it's just functions. Okay.
What are meridians?
Yeah, that's my next question. What are the meridians?
Well, this is really interesting because meridians are also actually real structures. It's the fascia, the connective tissue in our body that surrounds, and the fascia, as we know, it's that very thin fibrous material that surrounds our muscles. It connects our organs together, and it connects groups of muscles together. So these groups of muscles of fascia each form a particular meridian. So the bladder meridian, which starts at the front of our head and goes over the top of our head, down our back, is actually the posterior chain of fascia and muscle tissue. And so it turns out that actually there's some imaging studies that I saw done where you can put a dye, a tracer into, for example, stomach 36, which is along the muscle on the front of the leg, the tibialis anterior, and they can monitor the direction of flow of that tracer, and it goes in the direction of travel of the meridian.
Really?
And what's really cool is you can take the dye in both knees, inject it, and you can stimulate one point on one knee, and it will speed up the traveling of the dye in both knees.
Really?
So there is some sort of physiological correlation to the anatomy of the body. And so Qi is more than just this magical energy.
Yeah.
And meridians are more than just this symbolic pathways in our body. Yeah.
Because I've looked at these diagrams of the meridians, and I always felt like, kind of like you just said now, the meridian for fixing something here was there, and the meridian for fixing this was there. And I was always like, how is that possible?
And that's using that central nervous system to regulate the body. What's really interesting is, for example, if I'm treating someone's tennis elbow, the elbow, I don't know how it exactly works. The elbow is similar to the knee. They're anatomically analogous.
Yeah. Right.
So I can use the opposite knee to put points in that same area on the elbow, the balancing meridian on the elbow, to treat the pain in the knee. And people will be amazed. I'll say, move your elbow. Oh, there's no more pain. Why is that? That's something that maybe more research is needed on it. Exactly what's happening there.
And that's the case with so many things in medicine. We know a lot of the what's, but we don't always know
the whys. Yeah. So what does a typical session look like? So when I was getting acupuncture, somebody that works in the office, it was over lunch hours, so it's kind of quick a little bit, But what does a session look like when a patient comes in and they say, I've got chronic headaches or knee pain or whatever? What does a session look like?
So when it starts at the first call, once the patient's scheduled, they'll get a new patient history form that they can fill out on a secure site. And I'll have that information. And some of the questions that are asked, people may look at and say, why am I answering this? That has nothing to do with my problem. But that's actually one of the most important things you want to do is fill out everything so I can see the big picture, because everything is connected, as we say. And so once I have that information during the first consultation, I will ask some more questions and do an intake. I will do an exam, and then I'll determine what the problem is from there. We'll discuss the history, and I'd like to know their story as well. For example, if someone is unable to pick up their grandchildren, if that's what they really want to do because of their back pain, I'll know that's our goal. Okay. I'm going to get them to that stage.
Interesting. So when I've gotten acupuncture in the past, I've noticed that, not always, but sometimes when the needles are placed, you get kind of this sensation. It feels almost kind of like warm, or this tingling sensation. What is that?
So the term they call it is dechi.
Dechi?
So it's dechi. And it's sometimes I feel it as a heaviness or an ache or some warmth. And that is the nervous system once responding and regulating itself, but it's also the increased blood flow to an area, that warmth that you'll be feeling.
Okay.
And sometimes patients will say, I feel this in another part of my body. All of a sudden, this old injury that I had started to flare up, and then it subsided. It's that blood flow going through that area. And I describe it to them as, think of it like an old congested pipe that's clogged. As we're increasing the pressure in it to get things moving, we're going to get it out. We're going to get things out of there.
Okay. And I kind of like that too, because, when you think about disease, no matter what the disease is, I think for the longest time we've looked at disease as though it's kind of localized. You've got a problem. Right. You've got a problem there. But what we're recognizing now is that most diseases, at least the way we look at them now, is there's some element of inflammation. And inflammation is a body-wide process. Like for example, when there's the link between poor dental hygiene and heart, people say, how is that possible? And my mouth and my heart. But it's inflammation from the poor dental hygiene that leads to inflammation in the blood vessels in the heart, that increases the risk of heart disease, leads to inflammation in the knees, pain in the knees. And so the body truly is one big united system.
Right. It's the end of gut health and dementia. Right.
Exactly, yeah. And it's not just the body, but it's that body and mind. So, we have that mind-body connection, but it's more of a connection. I feel like they're intertwined and they're inseparable. So we have to also look at the stress level someone's encountering, and we're going to regulate, which is what acupuncture also does, which probably helped you sleep, was it regulates that sympathetic parasympathetic balance. The sympathetic is that fight or flight, and the parasympathetic is what we call that rest and repair state. When we're relaxed, that's when our body can actually heal itself.
So what does the average session look like? I'm coming in for an acupuncture session, and I know you do a lot more, but just acupuncture. What does the average acupuncture session look like?
Typically, once someone gets on the table, for the most part, most conditions, I can treat with the arms and the legs. I'll do some auricular ear points, and that'll, as we know, we can treat one part of the body, and that will address another part of the body. But they'll be laying on the table, typically face up, and I'll be putting anywhere from 4 to 12 needles in, on average, depending on the points I'm using, and they'll rest. A lot of times I'll use infrared heat. One, it brings blood flow to areas, and it also is relaxing. And we'll apply that, and they'll be resting on the table for anywhere from 25 to 30 minutes.
Okay. And what about mental health conditions? We were speaking about that earlier with chiropractic medicine. What about treating mental health conditions, depression, anxiety, with acupuncture?
And I would say probably the second most common thing I see in my clinic would be anxiety, depression. What I do is, if someone wants to avoid medication, we work on that, and it will be a combination of the acupuncture, possibly herbal medicine, and definitely meditation, breathing exercises, things to get them out of that fight or flight, especially when they have an acute situation where something sets them off. But then also, if they want to get off of their medication, what I will do is I will have them work with their MD, whether it's their primary care physician or their psychiatrist, and we will allow them to taper off the medication as their symptoms start to improve.
It's amazing. It's like what's old is new again, right? You hear everybody talking now about meditation, about breath work, about cupping, big thing now, I find it amazing. But pregnancy. Is acupuncture safe in pregnancy? And what kinds of benefits to get people, I'm totally tongue-tied, I'm so excited here. No. But is it safe in pregnancy? And how does it benefit people in pregnancy?
So one of the conditions I treat is morning sickness.
Oh, really?
Acupuncture can be very beneficial for that.
Really?
So during pregnancy, one of the first things that comes up for people is typically morning sickness.
Yeah.
There are some points you want to avoid and areas you want to avoid. Obviously, the belly, and there are certain points which, especially later on in pregnancy, can stimulate a downward movement in the body of we call it energy, but let's just say the chi in the body. So it can increase contractions. There's actually I've done some assisted in patients in getting their
Cervix.
getting the cervix prepared for the delivery. Okay. So I had a patient recently. She had her baby daughter, and her mom was in the delivery room with her, saying, "You don't seem like you're in pain at all," and the delivery was extremely smooth. We've also helped with induction. That's the word I was.
Gotcha. Okay.
Yes, it wasn't coming to me at the time, but so labor induction as well. We use those what we call forbidden points, essentially to cause that downward flow. It's LI4, GB21, and that'll help stimulate the body to get the baby moving in the right direction.
So you would only do that towards the end of the pregnancy?
Towards the end, yeah, within the last 2 weeks.
Interesting.
And what about positioning of the baby? I know a lot of times when the babies are not head down, when they're breech or transverse, some folks will get acupuncture.
There is a technique for that using moxa, which is an herb that you burn over a very specific point on the body, bladder 67. And we do have patients come in for that prior to trying to have it manually. Having the baby shifted, just to try that first. And I'll send them home with instructions. We'll try it we'll do it in my clinic. I'll explain how to do it, and then we'll send them home with the instructions on how to do it at home. Interesting. And their husband can help them as well if they can't reach down to reach the toes.
So when you're dealing with patients and you're doing acupuncture, like you said, you can use it to treat acute issues, chronic issues, and preventatively. So in general, when people come in for acute issues, do they typically have these issues fixed, or do they need to come in for tune-ups every once in a while, or what do you typically see?
So what I tell people is the younger you are, the healthier you are, the faster the response.
So we're out of luck, basically. We're out of luck.
And so high school athletes are fun to treat because within the first treatment, they'll be significantly better. Younger people, and the older we are, the more medications we're on, the more the more poor the health. It may take more than one treatment to see that for initial response, especially for a chronic condition. So it really depends, but overall, I can usually tell people once I see them and examine them, expect this or expect that.
So people have to be patient in certain situations. What about the risks? Are there any risks to getting acupuncture, or are there people that should just avoid it altogether?
It's generally very safe. There are certain conditions where you want to avoid, like I mentioned, with the pregnancy. Obviously, broken skin is an area you don't want to treat. Overall, I did have a patient recently. He had stage 4 cancer, and his white blood cell count was 0. Oh, wow. So I said, I'm absolutely not going to do it. We're not going to do acupuncture because there's too much of a risk. Even though it's very safe, there's no risk of infection. So in that case, we did not. But overall, it's generally very safe for most of the population.
Well, this has been amazing. Like I could talk about this for hours. Like, I mean, it truly is something that interests me so much. But where can people find you?
We are at easternhealingtraditions.com, and we are located in Grays Lake, Illinois, 224-541-0022.
Are you on social media?
We are on social media.
Eddie. Same place, Eastern Healing Traditions?
Eastern Healing Traditions, Facebook and Instagram.
All right, so are you going to come on again? Keep in mind, in Illinois, a verbal commitment is a contract. Are you coming on again?
I would love to. I'd be glad to. Thank you for being there.
We'd love to. I would love to go to the office and get some acupuncture and video that as well, because A, I'll get a good nap, B, I'll feel better, and C, we can make people not afraid of the needles.
There you go. All right. Well, thank you for coming on. We'll have to do it again real soon.
Thank you.
All right, thanks. Thank you. Okay, this episode is almost done, but first, today's prescription TikTok.
This is why you occasionally need to take your rings off. This guy kept his ring on for years, and it made microcuts in the back of his finger, and scar tissue formed on top. He can't take this off anymore. So now it's an anti-theft device, but if you want to take it off, it needs surgery.
Okay, so how often should you remove your ring? Well, there's really no consensus, but most doctors would say remove it every day. Clean the ring, clean the skin. Look at the skin where the ring sits. Make sure there's no cuts, tears, fissures, inflammation, or irritation. And if you have certain health conditions, diabetes, peripheral vascular disease, arthritis, lymphedema, you probably shouldn't be wearing rings at all. So, okay, can you count out 2 questions, sir?
So have you ever taken off your watch at the end of a long day, maybe the end of a long week, and smelled your wrist?
I have not.
Okay, well, let me tell you, if you do, it's not a good thing. So I am team every day. You need to wash that wrist, take off the watch, wash your wrist, take off the rings, wash your fingers every day. So that's my advice.
All right. Well,
That's the consensus.
That's the consensus. All right, this appointment is done, so make your way to the waiting room, stop by the reception desk, and don't forget to make your next appointment for second opinion with the Twin Doctors. I'm Dr. J.
You stepped over my line. I'm Dr. Hyde. We are the Twin Doctors, and this has been Second Opinion with the Twin Doctors.